I think I've always done it, call it person-centered care. I think I've always done that. It's, listening to people. What do people want? What matters to them? All these phrases are in the ether now, but it's kind of what I've always done. And now somebody's helpfully labelled it, because our system doesn't understand things unless it's got a label and a flow, and it's got a nice little handbook that tells you that you should listen to the patient in front of you. Surprise, but unfortunately that's how it is. But it's good as a movement, that we've got to the point where we are trying to join things up, because it's always been out there, but how do we get more professionals to get on board with it? And I feel like it's more of an approach rather than it being a project or a service, which does slightly annoy me, because I feel like it's something that should be ingrained and embedded across our whole system. But because we've kind of gone the other way for so many decades, you've got a lot of entrenched behaviours, and we're not going to change things overnight. And it's possible that it's some elements of the system we may not be able to actually change things, and there'll be other levers and things that will make that happen. I've learned to trust the individual. I am a sceptical person generally. And when I came on this journey, when I was introduced to the concept of the patient or the individual being a partner in their care, that was new to me in some ways, especially when it came to traditional services such as GP services. I always thought GPs have the credibility, and patients should follow that. However, doing a person-centered care in a focused way has totally flipped my thinking. That if you do run with what the individual wants, there are huge benefits. But in order to have the confidence to do that, that requires lots of special ingredients that we have in the health and social care system, but they're not all in the right places. So sometimes, because if we think that hierarchy is going to solve this problem, then we're very much mistaken. There will be people with a person-centered approach that sit in all different layers of the hierarchy, and it's really bringing them together as a movement. Really, I think that's going to unlock all of this. That's what I've learned the hard way. Taken some, had some falls and hits and pushbacks along the journey, but I've learned go with the willing, because that's where the real gold is. Moving beyond the labels, not just doing things because there's a program called the personalised care program, or whatever the latest one is, or social prescribing, or what all of these things are, but actually just embedding it across our system, and that is going to involve some pain, and in terms of change, because not everybody wants change, but that's not a reason not to do it. And if we don't feel any pain, it means we haven't actually changed anything. We're just talking about change, and we've convinced ourselves that we've changed something. Because we know, following change curves and change cycles, unless people feel pain, in terms of that disbelief, anger, this was the traditional way we did things, we're not on the curve. We've just convinced ourselves that we've changed something. We've probably just tinkered with things on the sidelines.